Stuart Wagner is doing one of the things he loves most, working on his serve on a sunny Florida day. But his serve was the last thing on his mind the day Stuart suffered a heart attack.
Just as we finished lunch, I had a chest pain. Accompanying the chest pain was a pain in the arm. If I knew I was having a heart attack, I would have called 911. But I didn't know I was having a heart attack. So I'm very glad I went in. They said, quote, "You saved your own life."
On average, nearly 1,230,000 Americans suffer a heart attack each year. Of those, about 34% will die from it. That's why getting timely treatment for a heart attack is so essential. Medical personnel refer to it as STEMI times.
STEMI stands for ST segment elevation myocardial infarction. And that's a very important determination because it involves the total closure of a major vessel. And when the coronary vessel closes, a large portion of the heart muscle begins to die. That process evolves over the course of several hours. The greater the period of time from the time the artery closes until the artery is open again, the greater amount of heart muscle damage that's done.
The goal for hospitals nationwide is to reduce STEMI times. But to do your part, it's essential that everyone knows the signs of a heart attack.
Chest pain, pressure, sometimes a shortness of breath, sometimes people have a feeling of weakness and as if they're going to pass out. Many times the symptoms are very similar to that of indigestion.
Once a patient is diagnosed with a blocked artery, the hospital personnel have a highly orchestrated treatment procedure they follow.
My experience going into the emergency room was excellent. In fact, to me it was unbelievable because I walked in, I said I had chest pains. Immediately they had me on the table, they tested me out, and I was told I need 3 stents.
And then the patient is taken emergently from the ER to the catheterization laboratory where we do the angiogram. This is an invasive test. By that I mean in order to take these three-dimensional pictures of the heart arteries, we insert with mild sedation and local anesthesia through a small incision, a small nick in the groin, a long, thin, hollow tube that's called a catheter. The catheter goes inside the heart. It's painless. You don't feel that. There are no nerve endings on the inside of your blood vessels nor on the inside of your heart. So you as a patient are not even aware that we're doing this. And so we have these images to review. So literally, as we're taking the pictures, we know exactly which artery is involved causing the heart attack.
At which point a surgeon will typically insert a balloon-like device to deploy a stent that keeps the blocked artery open. Aventura Hospital and Medical Center's parent company, HCA, has made reducing STEMI times at all its heart facilities a priority.
HCA has been extraordinarily supportive at all levels in terms of their cooperation with EMS, hiring the emergency room technicians and personnel, physicians. But there's never been a question about whether they should do it. It's only, how can we do it better?
For patients like Stuart Wagner, that commitment to excellence has made all the difference in the world.
If it weren't for the staff of the Aventura Hospital and Medical Center, I wouldn't be here now.
Reporting on the faces of HCA for the Healthcare News Network, I'm John Bafar.